We'll be reviewing the human clavicle, scapula, and arm structures. We'll start with the clavicle. The clavicle begins at the sternal end, articulates with the sternum, and at the lateral end we have the acromial end of the sternum. It articulates with the acromion of the scapula. This anterior structure on the scapula is called the coracoid process, and it's shaped like a letter C. Just inferior to the acromion, there is an indentation called the glenoid fossa. The glenoid fossa helps to make this diarthrotic ball and socket joint with the humerus, the big bone of the upper arm. As we turn the skeleton around, we can see the scapula more clearly. Some people call this the shoulder blade. We're going to call this the scapula, though, and when we look at the scapula, we want to note the medial border and the lateral border, and we want to note their position. We want to make sure that the patient doesn't have flaring or winging of the scapula. And we also want to make sure that the scapula are positioned correctly. The scapula are originally created in the cervical region and then descend down into their final position prior to birth. There are some conditions where undescended scapula is part of the pathology, or the congenital anomaly, I should say. So here's our scapula with a medial border, lateral border, and then this bony structure across here is called the spine of the scapula. So we follow that spine of the scapula anteriorly to the acromial process. Here's the coracoid process, the glenoid fossa. Here's the head of the humerus, which makes our ball and socket joint. And as we make our way to the elbow, we'll see that the two bones of the forearm join in at the elbow. This bone is called the ulna. The ulna fits into the posterior surface of the humerus and forms another diarthrotic joint called a hinge joint. When we place the skeleton in anatomical position, we see that the ulna is closer to U. U-L-N-A, ulna. The radius is always on the thumb side. No matter how I place this arm, it's always on the thumb side. If you place your elbow on the table, you can rotate your thumb around. You can move your hand. And the reason why we can rotate that hand around without moving the elbow is because these are two different bones. The ulna stays stationary and the radius rotates around. The head of the radius is round and allows that rotation. As we move down to the distal end, we see a series of little bones in the wrist. These are called carpals, and that's where you get carpal tunnel syndrome. The middle of the hand, a bone's called metacarpals, and then we have fingers, which are called phalanges. It begins with a PH, not an F. Toes and fingers are called phalanges. So in review, we have phalanges for fingers, carpals, metacarpals in the middle of the hand, carpals in the wrist, ulna, which is stationary, radius, which rotates, humerus, clavicle, and scapula with the spine of the scapula.